Sunday the 19th of September, and you're most welcome to this video. Now today I want to be thinking mostly about the idea of booster shots in the context of the FDA's panel decision not to recommend booster shots to everyone. And what we're going to do is look at the arguments, some scientific arguments for booster shots and against booster shots. We'll look at the against booster shots first, then for booster shots from a couple of scientific papers. But before we do that, I want to look at some orientation. Firstly, to keep up with date because things change so quickly in this pandemic, of course. And secondly, because it's going to help us with what we're going to be considering in terms of for and against booster doses. An interesting debate it is, actually. So moving on to some orientation first of all. New daily confirmed cases. Well, we can clearly see that New Zealand is here at the bottom, so that's doing well. Then Australia, then Canada and Ireland. United Kingdom is sort of coming down a bit. United States is going down a bit. And Israel, as we've noticed before, has been very high but is now coming down a bit. And Israel is going to be very pertinent in the debate about booster doses or not. Number of COVID-19 patients in hospital per million people. Well, again, we know this is very unequally distributed in the United States. We know that we looked at Idaho recently and some of the southern states where it's actually quite high. Other states aren't so bad. Then moving down, Israel, despite the high number of cases, relatively low level of hospitalizations, just above the UK, then Ireland and then Canada. Pretty constant increase in Canada over some time there, it has to be said. New daily confirmed COVID-19 deaths per million. Well, unfortunately, we see the United States is still highest due to the 90 or so million people, not entirely, but largely due to the 90 or so million people eligible for vaccination in the United States, not yet taken it up, probably a little less than 90,000 now, probably nearer 85, but still many millions of tens of millions of people not taking the vaccine offer up. And then next in terms of deaths, Israel, we see it had picked up quite significantly in Israel. Then the United Kingdom, then Canada, Ireland, Australia and New Zealand in that order. Now, these are the R values, the effective R value. Now, this value here, 1, is that the cases are neither increasing nor decreasing. On average, every infected person replaces themselves with one other infected person. So we see that the incidents are actually going down slightly, although not a lot. Ireland, New Zealand, United Kingdom, just below the R equals 1. So in theory, their cases will continue going down in those countries, although, of course, things can change, as we know only too well from this pandemic. I'll probably go into that a bit, actually. We can see that better there. That's it. So we see there's the R1 line there. So that's United Kingdom, New Zealand, Ireland. Then the United States, so increasing cases. Australia, increasing cases. Canada, and then Israel still fairly high in terms of number of new cases. So that is the R value in those various countries we're looking at the moment. This is the share of the population fully vaccinated. Now, we see actually that Israel, the fully vaccinated cases aren't that high, and they've been level for, or level-ish. This is the Israel line here for a long period of time. Basically, Israel's been about 3 months ahead. So this is their vaccination line along there. So we see Ireland, Canada, the United Kingdom have all got more doubly vaccinated people. Then the United States, a fair bit behind, it has to be said, behind Canada and the United Kingdom, for example. And then Australia and New Zealand are catching up. New Zealand could well be catching up rapidly enough. Is Australia catching up rapidly enough to prevent some major outbreaks there? We still don't know. But this is the number of vaccine doses administered, and we see Israel is ahead. So Israel is not that high up on the doubly vaccinated stakes, but when we look at the total number of vaccines administered, we see Israel is higher. And this, of course, is because Israel started giving their booster doses on the 30th of July. So overall, more doses have been given in Israel, but quite a few of those represent people that have now been vaccinated 3 times. Then in terms of total doses, Canada, Ireland, the United Kingdom, United States, Australia and New Zealand. So I just thought that was some useful orientation to help us today. Now, let's get straight onto the main business of the day, really, which is FDA panel reports, as we've been waiting for. Now, we did talk about this a couple of days ago, and we said, well, we're not really sure which way they're going to jump, because at first it looked for sure like they were going to go for the extra booster dose for everyone over the age of 12, as they are in Israel, in fact. And in fact, President Biden had actually said as much about a week or two before, so it turned out he's jumped the gun a bit, to be quite honest there. And we weren't sure which way it was going to go, but as time went on, it looked like there was more and more hesitancy within the Food and Drug Administration to recommend vaccines for everyone, and that's what it's turned out to be. So they voted against giving booster doses to all by 16 members of their panel to 2. So an overwhelming majority, but we noticed that 2 people voted against. So 2 people were in favour of vaccinations, booster doses for everyone. But when it was voted for a booster dose of Pfizer for anyone over the age of 65, unanimous a booster dose of Pfizer-BioNTech, 18-0 for those over the age of 65 and those with particular conditions like cancer or immunosuppression. It's going to be 6 months at least after the second dose of the last vaccine, 65 and over to begin with, and anyone at risk of severe illness. And final decision may include occupational exposure. So the FDA panel didn't particularly comment on people like nurses and caregivers, but they'll probably be included in the final decision. Now, this is advisory. This is an FDA panel. But of course, it's inconceivable that the FDA would go against their own panel. That would make a complete mockery of them. So they will go with this. And I'm expecting the CDC, who are coming out on this in the next week, perhaps next week. I would say late next week. They're going to go with this as well. I'd be amazed if they didn't. So they'll be coming out on that probably late next week. And I'm expecting them to confirm that. Administration wanted it for all 16 and older, but they haven't got it. 81 million people have had the Moderna vaccine in the United States. What's happening for them in terms of booster doses, we don't yet know. This is people who've had 2 doses of Pfizer are getting a 3rd dose of Pfizer. What's happened with people who've had the Johnson & Johnson vaccine, we don't yet know. We do have some trial data that says 2 doses of Johnson & Johnson vaccine, one Johnson & Johnson Janssen, then another Johnson & Johnson vaccine, are remarkably effective in terms of generating immunity, but we don't know yet. They have not yet told us. Now, the data on the Moderna booster should be out in the next week or 2. The data on the Janssen Johnson & Johnson vaccine, which of course was introduced later, might not be out till easily. It could be into next month. It could be October. So let's go on and consider these arguments now. First, we'll give the arguments against a booster dose for everyone. Then we'll give the arguments for a booster dose for everyone. Now, first of all, the against the booster dose for all. This is the argument against that. This largely comes from this article in The Lancet. Do check it out. It's not actually a research report. It's more kind of a discussion piece, but we're going to bring up some of the articles that are, or some of the things that are in this article in The Lancet. So the authors here say enhanced immunity in vaccinated people is appealing. So they kind of like the idea, but they're saying it should be evidence-based. Now, what they're saying largely is that a lot of the evidence for a booster dose is observational data rather than trial data. That's one of the reasons they're reluctant to go ahead, or one of the reasons that these authors are arguing against booster doses for all. Should be evidence-based. They want to consider the benefits and risks for the individual as well as society. And I think this is important. I mean, I think the politicians are pretty clear that this is good for society as a whole. But of course, in medicine, we want to know what's good for the individual. So we've got to take that fully into account as well. That's what these authors are arguing. And they say COVID-19 vaccines continue to be effective against severe disease, including that caused by the Delta variant. So basically they are querying the need for this in terms of protection against severe illness and death. And the data on that, they claim that the data that seems to suggest that is waning, they are saying is observational data, not sufficient to act on yet. Now, probably consistent with this, Sara Oliver from the CDC, this is not part of this paper, but through July, adults 75 and over were 88% protected against hospitalization. So that's a pretty good level of protection. That's in parenthesis from this paper. So you can see why they're saying that. And of course, these are the most vulnerable group, the over 75. They're saying decisions about boosters are informed by reliable science more than politics, or at least they should be, of course. But they're concerned about the observational nature of these studies, which, to be fair, they are. These are not randomised trials that this recommendation to booster dose more people is based on. But of course, they're arguing against that idea at the moment. They do point out in other studies, I'm not sure if this was in this paper, but Pfizer was a co-sponsor of the study, indicating that another dose of vaccine would be required. Now, no one's saying financial interest is being put above medical interest, but some might argue that Pfizer have a vested interest in rolling out a third dose of Pfizer vaccine. Current vaccine supplies could save more lives if used in previously unvaccinated populations. In other words, another argument the authors are using here against vaccination for everyone in the United States, and by extension the argument applies to the UK. We should be vaccinating the world. The most benefit is derived from vaccinating those who have not yet had a vaccine dose. In favour of the immunocompromised, so the authors say, well, people that are immunocompromised or immunosuppressed, so people with immunosuppressing illnesses, people on steroids, people with cancer, people on cancer treatment, people who've had organ transplants, they think they probably will need a booster dose, but they suspect a booster dose of a different vaccine to give a different type of immune response would be better. And I think this makes a lot of sense, particularly if someone has not responded to the first dose. So if someone's been given the first dose of, say, Pfizer vaccine and they haven't responded to it, then why not try Johnson & Johnson as the second one would be the argument, because if they haven't responded to one, then try them on something else. And this is what we've always done. I mean, from time to time, we've had students, all the students get vaccinated against hepatitis B, of course, now. And from time to time, a student would not respond to the first vaccine, so we gave them the different brand. And usually they did respond. It's the obvious thing to try, is just try a different brand. So that is what they are suggesting there, rather than giving the same vaccine again. And that does make sense to me. Boosters might ultimately be needed for all, but not yet, is what they are saying. So, for example, if there's waning immunity or because of variants expressing new antigens. So if the immunity carries on waning, which they don't see full evidence for, or because there's a variant that is antigenically different that the immune response doesn't recognise, therefore the new variant exhibits vaccine immune escape, they would be in favour of it then. But again, they're saying they're not there yet. Another concern, boosters may have immune-mediated side effects such as myocarditis. Now, myocarditis is more common after the second dose of Pfizer and Moderna vaccine as opposed to the first dose. And what they're saying here is, given that these immune-mediated side effects such as the heart inflammation, the myocarditis or the pericarditis, as it was more common after the second dose, it may also be more common after the third dose. And really, we don't know that yet. So that is their concern. The first dose, it wasn't so bad. Most reactions are after the second dose. Would you get even more after the third dose? Is a bit of an open question. And that is concerning the people arguing against a booster dose of Pfizer, at least for everyone. Because if things did go wrong there, that's got big implications for all vaccinations, not only COVID vaccines, but everything else. Now, there's some further reasoning here that I'll try and summarise this because it's a bit complicated. What they're saying is that people that are given the Pfizer vaccine now, for example, in the times of the Delta variant, are still generating a good antibody response to the Delta variant, even though that the antibodies that were given originally for people that were vaccinated 6, 7, 8, 9 months ago, they've waned. But what they're saying is, because this vaccine still generates a good antibody response to the Delta variant, it probably means that in the past it's already generated a good response in terms of the B cells and the T cells and the memory cells, is what they're saying. So they're saying because it generates good antibodies against Delta now, there's no reason to assume, in fact it's logically likely to be the case, that because the vaccine was given 8 months ago, that the memory cells that they produced 8, 9 months ago are still going to be effective against the Delta variant, is what they're saying. And that was further reasoning from that, and that's further reasoning that the level of protection against severe illness and death is probably going to be good, and therefore further vaccinations would not be necessary at this stage. They also say there's opportunity to study variant-based boosters. So we've been waiting for ages for boosters which are specific to a particular antigen, a particular viral type. They haven't come yet. These boosters are the same, what we might call the Bogo vaccine, the original one from way back. They haven't changed it. So they're thinking that we need to study this and then consider a more specific booster dose at a future date. And then if it's a more specific one, they're saying it could probably be given at a much lower dose. And of course, in medicine, we always give the lowest dose possible for any given effect. We always give the lowest dose of the drug we can get away with. So that's the argument against boosters for all. Now the argument for boosters for all. Largely this data comes from Israel, where they're saying protection had waned. That's what they're saying in Israel. Booster campaign started at the end of July, 30th of July it started. Now, this lady here, Director of Public Health, Israeli Minister of Health, she said thousands of cases, they were getting thousands of new cases in Israel, doubling every 10 days. So it was back to the old nightmare, doubling every so many days scenario in terms of cases. And she says this, if we'd not started boosters at the end of July, we would have come to the capacity of Israeli hospitalization capabilities and gone beyond it. In other words, there would have been unnecessary deaths in Israel had the Israelis not started the booster campaign, according to the director of public health in the Israeli health ministry. So pretty strong words, and that gives a pretty compelling argument, actually, it has to be said. But let's look what this paper says now. This is called Protection Against Pfizer Vaccine Booster Against COVID-19 in Israel. And this is from the New England Journal of Medicine. And it has to be said, the arguments I'm about to give are pretty powerful. They are pretty powerful, but FDA hasn't really followed on with the Israeli data, which is interesting. Also an article in Nature magazine about it there. So now this is data from the 30th of July to the 31st of August, from people that had been vaccinated at least 5 months earlier. Now, the vaccination program, the booster vaccination program in Israel started in people over the age of 60. They're now vaccinating over the age of 40 because it went down the ages, as you would expect, vaccinating those who had the vaccine earliest and those more at risk. So this data is for the over 60s. But they are saying that the data that they have from the over 50s and the over 40s is very consistent with this. So it does seem to be a consistent pattern that's emerging through the 40 to 70 plus age range in Israel. Now, the over 60s, 1,137,804 of them, so that is a pretty good sample size. Confirmed infections, 4,439, severe illness, 294. So they've got pretty good numbers to play with here. In other words, good numbers to plug into their statistical analysis. So good numbers. Well over 1.1 million vaccinated. Pretty well 4,500 confirmed infections and nearly 300 severe illness. So you can get pretty good stats out of this, and of course they do. They've got good statistical techniques employed in this paper, of course, as you would expect from the Israeli Ministry of Health. The other thing about this is it includes data from the ultra-Orthodox Jewish population in Israel, the ordinary Jewish population in Israel, and all of the Arab population in Israel as well. So this is across the ethnicities in Israel, which is good to see and gives pretty comprehensive data. Now, the booster group had been doubly vaccinated, and they looked at the rate of confirmed COVID-19, the rate of severe illness at least 12 days after the booster dose. So these are people doubly vaccinated. How they're doing 12 days later in terms of rate of confirmed infections, how many infections did they get, how many severe illness did they get. The non-booster group was the same, but of course they weren't given the booster. So the non-booster group that they were comparing them with, doubly vaccinated, what's their rate of COVID-19 infection, what's their rate of severe illness. So pretty good really. We've got the booster group and we've got the non-booster group, all based on large numbers. So here come the results, which are pretty convincing, as I said. Rates of confirmed infection were lower in the booster group and higher in the non-booster group by a factor of 11.3 times. So there was 11 times difference, 11 times more infections in the non-booster group, 11 times less infections in the booster group. A factor of 11.3, not 11.3%, 11.3 times. So lower in the booster group, 11.3 times lower, over 11 times lower. In the non-booster group, over 11 times higher. And for severe illness, hospitalization, even more convincing. Of course, they looked at the rate of confirmed infection, and they also looked at the rates of severe illness. And again, the rates of severe illness were lower in the booster group and higher in the non-booster group. But the difference here was nearly 20 times difference, 19.5 times difference. So the booster group had 19.5 less in severe infections. The non-booster group had 19.5 times more compared to the lower booster group. Now, of course, all these comparisons are between the booster group and the non-booster group. They're nothing to do with vaccinated or unvaccinated. They're just difference between those two groups, that's all. But pretty convincing, So 11.3 times less infections if you boosted, 19.5 less cases of severe illness if you are boosted. Yet, of course, the FDA panel know all this. They know all this. And this is the decision they've made. So there you go. That's all we know. They're the arguments against a booster dose for everyone, the arguments for a booster dose for everyone. And the Israeli data, unfortunately, this is the state of Israel Ministry of Health. So as we said, the results are holding true for the 40 to 50s, for the 50 to 60s and the over 60s. Now, they don't comment much on the safety, but they say booster dose adverse events not more acute than the first or second doses. So basically they're saying that the side effects after the third dose are not greater than the side effects after the first or second dose. And I can't tell you more than that because that's all there is on the website. That's the totality of the information. So that's what they're saying. Booster dose adverse events not more acute than the first or second doses. So that is all we have on that. So they're the arguments for and against. But I must say, from that Israeli data, those numbers, 11.3 times and 19.5 times, pretty convincing data. So but there we go. That's what the FDA panel have said. And as I said, the FDA will follow on from that. And I'd be amazed if the CDC see anything different. Political disappointment. Dr. Fauci is disappointed. But these are the processes that the United States uses, and very similar to the processes in the UK. So that's it. Over 65 in the United States. At the moment in the UK, of course, we are working down. The programme has just started with healthcare providers and vulnerable people at the moment in the UK, then it'll be going down the age groups for a third dose of vaccine all the way down to age 50 in the UK. So over 65 in the US, over 50 in the UK, and over, I can't remember in Israel, is it over 12 or over 16? Anyway, it's basically for everyone in Israel. I think it's over 12 actually in Israel. So basically everyone's getting the booster in Israel. So more data to follow, but that's where we are now. That is the argument. And that's basically all I can tell you about that, because I think that's all we know. So interesting story, more to come on it, and we'll keep an eye on it, of course. And thank you for watching this video.